My dad works in B2B marketing. He came by my school for career day and said he was a big ROAS man. Then he told everyone how much he loved calculating his return on ad spend. My friends still laugh at me to this day.
Not everyone gets B2B, but with LinkedIn, you'll be able to reach people who do. Get a $100 credit on your next ad campaign. Go to linkedin.com/campaign to claim your credit. That's linkedin.com/campaign. Terms and conditions apply. LinkedIn, the place to be, to be.
Welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm your host and public health scientist, Dr. Jess Steyer, and today we're going to talk about ways to stay healthy during pregnancy. The clock is ticking, so let's get to it. All right, so you know what they say, and it's so true. A happy and healthy mama makes for a happy and healthy baby. So one of the questions I get asked the most is, what are the nutrients that I need to take during pregnancy? So there are 3 that stand out: folic acid, iron, and calcium. Now, some of these things you can absolutely get from a very nutrient-rich, diverse diet that's, very rich in fruits and veggies. But folic acid in particular, that is something that is recommended to get from prenatal vitamins. So folic acid prevents neural tube defects, so super important. Iron is also important. It supports baby's growth and prevents anemia. And then there's calcium, which aids in bone development. So it is recommended that you take a well-balanced prenatal vitamin. You can ask your OBGYN for recommendations. These do not need to be super expensive vitamins. And definitely always consult with your healthcare provider. It is not recommended that you start taking any other herbal supplements or anything like that. Just because something is herbal or all natural does not mean that it's safe. Certainly does not mean that it's safe during pregnancy. And there can also be things like drug interactions. So definitely run it by your OBGYN. All right, so how much exercise is safe during pregnancy? For most women with uncomplicated pregnancies, the CDC recommends at least 150 minutes of moderate intensity aerobic activity per week. Now, this could include things like brisk walking, swimming, or prenatal yoga. However, it's really important to get your doctor's approval before starting or continuing any exercise routine during pregnancy. What about vaccinations? So the CDC recommends 2 vaccines for all pregnant women: the Tdap vaccine to protect against whooping cough and the flu shot. These not only protect the mother, but also provide antibodies to the baby. Always discuss vaccinations with your healthcare provider. Another big one, of course, now, in COVID times, there's also the COVID vaccine. These are also recommended during pregnancy, during any trimester. So definitely discuss with your OBGYN. How can expectant mothers support their mental health? Now, this is important, and obviously, easier said than done to say things like prioritize sleep. I remember, especially as I got further into my pregnancy, it became more difficult to get comfortable and to fall asleep. But if you're feeling tired and if you're able, let yourself sleep. Take those midday naps. You're growing a darn human, for crying out loud. You can also practice stress reduction techniques, whatever really resonates with you. Some people like meditation, deep breathing. And it is also important to maintain those social connections and try not to isolate yourself. Certainly do not hesitate to seek professional help if you're experiencing persistent feelings of anxiety or depression. Take care of your mental health just as much as you're taking care of your physical health. And don't be afraid to speak up, especially during those frequent OBGYN visits, to mention if you are experiencing some mental or emotional health disturbances. All right, here's a question that I've been getting a lot recently, and I thought that this might be kind of interesting to tackle on the pod. So, does playing music for the baby in the womb boost intelligence? So, while some parents play music hoping to boost their baby's intelligence during pregnancy, scientific evidence for this is limited. So, we do know that fetuses can hear and they can even respond to sounds from about 16 weeks of gestation on, but there's no conclusive evidence that prenatal music exposure enhances cognitive development. Again, we want to focus on overall health, reducing stress whenever we can, having a diverse and nutrient-rich diet. Those are the things that are known and evidence-based to benefit fetal development. All right. Well, I hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
If you're listening to this podcast, then we know you love learning. So let me tell you about Airwave History Plus, now available on Apple Podcasts. Airwave History Plus is your ticket to ad-free listening, bonus content, and early episodes from dozens of the most popular history podcasts, including History That Doesn't Suck, The Explorers Podcast, The History of World War II, Queen's Podcast, The History of Egypt, The Age of Napoleon, and more. For your free trial, search Airwave History Plus on Apple Podcasts and hit subscribe. That's Airwave History Plus, available now on Apple Podcasts. Airwave History Plus, the essential audio destination for history lovers.